So, hey everyone, thank you so much for joining us and welcome to Poderosas to the Front. My name is Sawyeh Esmaili. I am the If, When, How Reproductive Justice Fellow here at National Latina Institute for Reproductive Health. And today I am joined by Rose Berry from the Black Alliance for Just Immigration and with Edna Sandoval with California Latinas for Reproductive Justice. So hello to both of you and thank you for being here today.
Thanks for the invitation.
Thanks for having us.
Yeah. And to start off, would you each like to tell us a little bit about yourselves and the work that you do?
Sure. So my name is Rose. My pronouns are they, them, she, her, in that order. And as you mentioned, I work for the Black Alliance for Just Immigration as the Black Immigrant Women and Girls Program Specialist. I have been organizing for over 16 years, mostly issues that center Black folks, migrant folks, and women. And folks across the gender spectrum, including gender nonconforming folks. I am devoted to Black liberation in all of the ways that it needs to happen. And so that's most of what I do.
Hello, everybody. My name is Edna Sandoval. I'm an immigrant from Guatemala. I moved to the United States around 5 years ago. And since I moved to Los Angeles, I started to work on the movement pro-immigration. Right now, I'm part of California Latinas, and I also part in one of the founders of Con las Comadres, a multimedia project that tries to empower the voices of the women of color. We try to create awareness also in the issue of Afro-Latinidad and the issue of identity within Latino women, like Indigenous and Afro-Caribbean. I think it is important to bring awareness about it. And my interests cover the liberation of women in the third world and the diaspora women here in the United States.
Awesome. Thank you both so much again for being here. And so today's talk, the theme is undocumented and uninsured. And so let's just dive right in. So Edna and Rose, could you tell us what does accessing healthcare look like when you're undocumented?
So I guess I can start talking about what it looks like in California, since it's the place that I'm based. A lot of people have this idea of California as a sanctuary city, and usually that really erase the really big problematic that exists in California regarding to health issues, especially being a woman. For example, right now we have a medical spectrum that it was based recently Health for All, but it really left out a large demographic because the only people that can access as undocumented people are people under 25 or over 65. So that's a really large demographic. And we also have the Family Pack program, that is this little green card here, in which undocumented folks can access, but only to reproductive health. And then we have like little programs that help you in case you have like a serious and almost fatal accident, but otherwise you cannot access in a daily basis as undocumented. And there's also this really recent over fear on if you give you information, the information can be passed on federal, state, and then they can target you if you're undocumented. Right now, the laws that are passing overnight, so we really don't know, like if they say it's going to be confidential, but the administration has the power to break that one moment to other and access to that information. So that make immigrants that are undocumented a really easy target and a really, marginalized community that cannot access to basic care like health insurance.
Yeah, thank you for that. I totally agree. And this is obviously a really important question. I think it's important to note that migrant folks have to wait 5 years before they're even eligible for subsidized care, which, as we know, migrant communities are disproportionately poor. And a lot of them coming to this country seeking services and support. for poverty that they're facing back home. And so I think it's especially important for us to be uplifting the need for subsidized healthcare for migrant communities. It's something that migrant communities report, repeatedly being denied access to. And we're hearing more and more stories inside of detention facilities of migrants that are dying because of lack of access to healthcare and lack of urgency in getting folks healthcare inside of detention facilities. What I will say, though, is that BAJI and National Latina Institute actually sit on the HEAL Act Coalition, which is a national coalition of organizations coming together to really address exactly this issue, right? Migrant folks having access to subsidized healthcare and removing some of the restrictions like the 5-year wait period for folks to qualify for some of those healthcare services.
Yeah, one of the things that I would like to add as well is most of the time here in California, when you try to access to healthcare as an undocumented, you need to prove your residence in order to qualify. Like that's virtually impossible if you're working under the table, if you're using a pseudonym. Like it's really, really dangerous and put yourself in a situation of risk to prove that you've been here over a year. So many people that have been here for many, many years, they have literally no choice to prove a residency. So all these arbitrary demands in order to get healthcare are really created to leave these people outside the spectrum. And most of the people that is undocumented really rely on county programs and safety net services that are very, very unfunded. And a lot of them has a bias regarding reproductive health.
Yeah, thank you both for those answers. I think it really illustrates also just all the barriers that undocumented folks face and how much it depends on where you physically are, your location as well, for your access to any type of healthcare services. I do also want to point out that I think it's for example, under federal law, hospitals are required to provide emergency room care to everyone, regardless of ability to pay or immigration status. But I want to note how limited that care is. So, for example, when you're pregnant, no access to prenatal care or anything like that. Only your labor is covered. But that's just like your labor alone. So no pre or post anything really, which is really harrowing. And yeah, the only care that will be provided is to stabilize and not ongoing care needs. So
also to add to that hospitals are not safe for undocumented folks neither, right? Like community folks have been fighting really hard to fight back against like ICE being able to target folks in hospitals while they're seeking care, and in like family courts and in schools, places that should be safe for any person to go to. So also just noting that even though that, is provided as a very limited option, that folks are scared to even go to hospitals to get treatment.
Yep. And not even when you're there, but getting there can also be an issue too. Just lack of transportation, or if you have the transportation and you live in a place like Texas where NLIRH has an advocacy network, it's very likely that you'll pass a checkpoint. And so what does that mean? You decide between your care that you need or your status and your safety.
Yeah, that's another thing. Like, for example, in California, we have the medical extension for pregnancy that covers the pregnancy-related healthcare upon 6 weeks after you give birth. And according to Mike Estrada, she's like an educator in Insert Health, they have a lot of people coming from different parts near, outstate, and within the state just to seek that care. That's really risky, like you point, but it's a reality. The demographics, people keep moving, people keep risking because they're safe and they're unborn safe for those who decide to give birth.
Yeah, totally. So with all that, what could either or both of you also talk a little bit about what does accessing healthcare look like if you're in a detention center?
That's a really tough question. There's a lot of things that we can talk about. In fact, we can spend the whole time talking about all the burden that women on detention center pass, but I would like to just highlight some of the problems. For example, according to ACLU, these are the major issues, like the transgender issue. It's a really, really big deal, and I would like to focus on that, especially in the women of color transgender issue. Detention center, they basically put you in different sectors depending on your genitalia, independently on like what is your preference gender. So this raised the assault, sexual assault on trans women up to 60%. That's like an incredible high number. Then you have the barrier to abortion access, because you have to be elective to get an abortion. If they decide that you're not elective regarding of your mental health, regarding of your personal situation, they can decide over you and say you cannot access to one because you don't qualify. This is like one of the major issues that women that wants to stop the pregnancy face, as well denial of prenatal and postpartum care in accommodations. And just in the whole process that you're pregnant inside a detention center, the use of force, the mental abuse that you suffer, the depression postpartum that you cannot access to have like medical care, professional care, really, really mark a lot of the issues for yourself and for your kid. And that's really marks like future generation and how that is going to impact your own community. We also have the coercive sterilization. That's still happening. That's an issue. A lot of people think that in the past, it's something that is happening right now. Just between 2006 and 2010 in California, 150 women being forced sterilized. We also tried to pass a bill regarding that, to try to get economic compensation to women that suffer from forced sterilization. Here in California, between 60s and 70, the number, like, it's crazy. So it's something that keeps happening, especially in the detention center.
Yeah, thank you for that. I think for me, like, I just want to start with like acknowledging the moment that we're in, right? That we know also isn't just a moment. It's a long-standing harm that's been happening to our communities. But just for context, I think it's important to name that the federal administration has waged a war against women, Black and brown communities, and migrants, like all at the same time. So when you consider those things, the rights of women inside of detention facilities are like constantly under attack from various different angles. Especially when it comes to reproductive health right now. Yeah, we have the federal administration literally telling migrant women to go back where they came from in order to access reproductive health, which is just like mind-blowing. And then on top of that, I think oftentimes we leave out mental health when we consider healthcare inside of detention facilities. And so I don't think it's a coincidence that we're seeing more and more documented cases of migrant folks committing suicide inside of detention facilities, because, in addition to physical, the denial of access to, healthcare to meet our needs as far as physical health, folks are being traumatized inside of these cages and not having access to mental health services. And so I just also wanted to lift that up.
Yeah, thank you for that. That's really important to bring up, because I think also when we talk about health, it's really easy to just go straight to physical, but it's also really important to talk about the mental aspects as well. So thank you. So could you talk a little bit more about what have you seen in your work with regards to cases like Jane Doe, or, and for those of you who don't know that are watching, Jane Doe is an undocumented minor who, while in the custody of the Office of Refugee Resettlement, was refused access to the abortion that she sought, and she was held captive in ORR offices to ensure that she didn't get the procedure elsewhere. So could you talk a little bit more if you've engaged with that, with work on that, on advocacy on that case at all?
So not on that case in particular, but there, as folks know, there's organizations like Planned Parenthood that have been fighting back against like the Federal Administration instituting Gag Rule. And so there's already a global Gag Rule in place, as folks might know, that has impacted places all over the world. And pretty much what it does is it bans family planning clinics that get aid money from the US from performing abortions or even discussing abortions with their patients. And so the global Gag Rule has already, impacted lots of countries, and clinics are closing down all over the place. Crucial services that folks need are, they're being denied access to. And so now the White House is trying to implement a domestic Gag Rule, which would essentially apply the restrictions of the global Gag Rule to providers that receive federal Title X funds or federal funding. And so not only would it prohibit them, providers from like actually providing reproductive services, but even from referring their patients or talking about those reproductive services. So again, organizations like Planned Parenthood, today is actually a national day of action against the Gag Rule. So folks are like marching, folks are really talking about this online, folks have been, signing petitions and getting the word out about it. So yeah, that's one thing that's happening.
I will add that, thank you very much for that. You're totally right. In order to support that, I think it's important to us to advocate to our organizations within our communities that are fighting for the right of, like POC communities, women of color, transgender communities. It's important to relay a lot of them to get like community education and also to engage in political change, even as undocumented, create awareness within our communities on how this is affecting the community as a whole and support them. Even if we don't want to engage directly in the political education, political participation, it's important to get ourselves informed on those issues. And like Rose say, Planned Parenthood probably is one of the biggest providers of healthcare right now. And a lot of these small safety net health access keep referring women to Planned Parenthood, because even here in California is one of the safest places to go and seek care. So I will definitely encourage everybody to look more information on it and definitely engage in support.
Yeah, and just to add to that quickly, I think also just what Edna brought up earlier is really important to emphasize around, like, when we're talking about reproductive health, we're not just talking about contraception and abortions, which are two major pieces, but specifically when we're talking about Black and POC communities, we're also talking about forced sterilization. We're also talking about lack of access to like any sort of pregnancy services, et cetera. And also to uplift that, like, there's been an intentional, effort to block access for our communities to those services. And so I think in a moment like this, it's just like compounded, the amount of barriers that are being put in place for our folks.
Mm-hmm. And also adding to what Rose said, it's super important to start asking these uncomfortable questions. Why this issue is affecting this community disproportionately more than this other community? Start to challenge. When you're receiving healthcare, you pay attention to these kind of issues and you start to understand like your situation regarding your situation ethnically, racially, economically. So we need to start raising this question. We need to start bringing awareness of how these institutions had been so racist historically. We need to talk about that, not only in local level, but at a national level, and start to question who is receiving these services and who is not, and why, and what's the root of that. So I think we need to start asking this question openly.
Yeah, definitely. And thank you both for actually bringing up forced sterilization, because I'm sure, as you both know, it's not something that just affects immigrant communities. It's communities of color around the country. And as Edna mentioned, it's very recent. I mean, it was just last year that a judge in Tennessee was exchanging sterilizations for lesser sentences. So this is just, it's a widespread issue that affects not only immigrant communities, but I think communities of color generally. So thank you both for bringing that up. I think that's really important. Do either of you know of any pieces of legislation or policy changes that we should keep an eye out in the upcoming months for that would better access to healthcare for the undocumented community, or any other actions or policies?
I will definitely encourage people here to look about the changes that are about to happen in the Title X family planning program, because these changes proposed rule allows entities to receive Title X funding, even if they don't provide a single method of contraception. And most of the time, these clinics are community-based. So you have a lot of POC going there, women of color going there, seeking there. And a lot of times, if they are considering to have an abortion to interrupt the pregnancy, they don't gonna give the resources. With this, if this change pass, they don't gonna give them the resources to get a safe abortion. They're gonna encourage to not have an abortion. So we need to stop that. Title X was very important, and just right now it's about to be changed. And all this money, it's gonna go to create these harmful policies that really take away the autonomy of the women to take their own decision over their own bodies. So I will definitely go ahead, go on Google Title X, oppose and stop harmful changes to Title X family planning program. And they're gonna give you options to electronically go leave a message. We have until July 31st, so it's pretty soon. So I will definitely take action on that. It's extremely important.
Thank you for mentioning that, yeah.
No, I mean, I spoke about the gag rule. I think we have about a week left to stop it. And so from being instituted here. So I think if folks can, you know, do whatever's in your power to really fight that from happening.
Yeah. I think, yeah, it's really important to submit comments on that. I will note that the government is required to read every single comment that's submitted. So if you can and are able to, would very strongly encourage folks to go ahead and submit comments on the harm that would inflict. So what do we mean when we call for abolishing ICE, and how is that in line with reproductive justice?
I can start. I mean, there's lots that I could say about this, but to narrow it down, I think, you know, ICE is just an extension of the policing and prison systems in this country. And personally, as an abolitionist, I acknowledge that all systems created to harm Black, brown, and poor communities have to go. Like, they have to be dismantled, and it's the only way that we can build up new systems that actually center those of us at the margins of the margins, and that don't rely on imperialism to flourish. Also, just naming, I didn't talk a ton about my personal background, but I'm a migrant person myself, and I was born in Panama, and my family's from Honduras. So I come from actually 3 generations of migration to this country, and as a Black migrant in particular, you know, experience the intersections of oppression and the intersections of harm that come to our communities, and ICE is an extension of that. And I think what it has to do with reproductive health, right? It's like evident in the strategy of the current federal administration. There's something about the power of women, the power of Black and brown people coming together and rising up that is clearly a threat to white supremacist imperialism. And the current federal administration is trying everything in their power to distinguish that. It's happening through overcriminalization. It's happening through the blatant attack on reproductive health. And so, yeah, I mean, I think that it's all conflated, right? And they operate like separate systems, but really they're just extensions of each other.
Mm-hmm. Yeah, we also, thank you for that. You're absolutely right. We also are, myself, abolish against ICE, against the prison industrial complex, because they are affecting disproportionately to the communities of color, Black women, brown women. And for me, it's very important to highlight that these institutions criminalize communities of colors in every spectrum. So basically take away your ability to fight, because they're doing it under the law. And a lot of people see like abolish ICE not factible, but it is factible. ICE was instituted in 2002 after the 9/11, just to promote all this rhetoric, racist rhetoric, xenophobic rhetoric, to promote white supremacy nationalism of who is entitled to be here and who is not. And it's bluntly based on racial, ethnic stereotypes. So we need to abolish ICE. It is possible to abolish ICE. To people that say like, oh no, we cannot live without ICE. It was used until 2002, so you can put some numbers. And also I think it's important to talk about this hashtag Keep Families Together. To think about families outside this idea of the traditional family. We have all kind of families, transgender families. We have families coming from different parts of the world that also fit in the term of family. What is family for you? It's very personal, and it's an individual idea of what you feel safe in. So the undocumented community is really, really facing a lot right now, because this administration is doing everything they have in their hands to keep these families apart. So basically, we call to abolish ICE. This is just one of the reasons why.
Yeah, thank you so much for that, and mentioning the part about families. I think that's so important, and people forget that families can mean whatever you want it to mean, right? It's not just the traditional notion that we have of it. So, so thank you. And looks like we are just a few minutes left. We have a few minutes left, but I just wanted to quickly ask you both, what are some resources that you might be able to share based on your work and the work that your organizations do that can help undocumented folks access safe and affordable healthcare?
I can start. To be honest, there aren't a lot of options for undocumented folks, and that's the problem. And that's why I think we're having this conversation today. Even some of the newer subsidized healthcare that's been put in place that we're also at risk of losing, you still have to have some form of documentation. So like healthcare.gov, subsidized programs, etc. I think one of the things, just again, I was, just to get about my personal story, I was undocumented for 27 years. Well, during that time, experienced different levels of documentation, at one point undocumented. And honestly, going to my neighborhood health clinic was the only way that I was able to establish free care. A lot of community clinics will have community care teams or like offices that you can go to and talk about your status and be able to talk about what options you have for healthcare.
Yeah, I will definitely agree with Rose with that, especially because I wouldn't like to promote resources locally. I will definitely encourage people to go to the community organizations locally. They're gonna refer you to different places. Be aware that you need to look for one that really responds to your own necessities, because also we need to be careful when we seek help. Like we say, like there's a lot of clinics that's going to encourage you to maybe do something that you really don't want to do. ACLU It's a really great resource. They have a lot of data, and they have actually an app that you can download on your phone in case of emergency. They have a really great team that can help you to seek for legal assistance in case you need it. But that's the only one that I can provide that is not locally here based in California.
Yeah, thank you. Thank you both so much. And we are out of time. So I just want to thank you both again for your thoughtfulness and your answers and your being here today to talk to us a little bit. And thank you all that are watching for joining us and learning a little bit more about this. Thank you.
Thank you very much.
Thank you.
Gracias.